state's largest lesbian, gay, bisexual, and transgender advocacy organization, and I am overwhelmed. We have heard so many stories from folks. I mean, just your story was completely touching, and to hear the impact that the Affordable Care Act has on seniors is incredibly powerful, and I'm here today to make sure that the voices of the LGBT community are heard as well. Today's ruling is a ruling for fairness and justice, and it's a huge step forward towards ensuring equality for all LGBT Americans. We couldn't be prouder today to be a part of the LGBT community. LGBT health disparities are dire. Only 57% of transgender Americans have health insurance. That's compared to roughly 82% of heterosexual counterparts. That's a huge problem. And the Obama administration has done an incredible job of addressing some of the most serious health disparities, including lack of access to competent treatment, lack of access to affordable treatment, and lack of access for both parents in making healthcare decisions for their children or for their spouse or for their partner. The Affordable Care Act today has been upheld, and that goes a long way in addressing some of the more serious health disparities. There's a lot in the Affordable Care Act, that's for sure. I will admit I haven't read the whole thing, but there are some pieces in the ACA that go a long way towards addressing LGBT health disparities. The first and foremost is that it includes provisions for data collection so that healthcare providers know what they're dealing with when they've got an LGBT patient. Far too often you see LGBT people and their children with inadequate healthcare services. The ACA goes a long way towards addressing that by requiring not only data collection so that we know what we're dealing with, but also cultural competency training so that healthcare providers across the country understand when a lesbian mom comes into her doctor's office, they know what she's dealing with because it is different in some cases. The second piece of the Affordable Care Act that is crucial is the Patient's Bill of Rights. We've already talked about lifetime limits that have a profoundly negative impact on people facing catastrophic illnesses, but it also has an impact on people living with HIV and AIDS, in addition to transgender Americans who require ongoing healthcare services. The Patient's Bill of Rights also ends pre-existing condition limitations, which again have a profoundly negative impact on LGBT patients. I can't say enough about what the ACA does to benefit the LGBT community. Another piece of this is coverage of preventative care. This benefits not only middle-class Americans and seniors, but it benefits LGBT Americans who face lower health outcomes, more negative health outcomes on everything from obesity to diabetes to HIV and AIDS. There's different factors that impact the LGBT community in a different way, and the coverage of preventative care goes a long way to addressing that. In addition to the Affordable Care Act, the Obama administration has issued an advance directive to make sure that all federal hospitals that receive federal money treat partners equally. No matter how your family is formed, you're going to be able to make important medical decisions for your family. While we're absolutely celebrating today, we know that there's a long, long road ahead of us. We must remain vigilant and ensure that all pieces of the ACA are implemented fully. And another piece of this is that we must repeal DOMA. DOMA is the federal law called the Defense of Marriage Act, and it limits marriage and does not recognize married couples who are married in states like Iowa, where marriage equality is the law of the land. As long as DOMA stands and as long as the ACA is not fully implemented, LGBT Americans will face inequalities. Again, we are so pleased with the ruling today. It is a ruling for fairness and for justice, and we're excited to get to work. Thank you.